A diploma program is going to allow students to graduate quickly and get essentially right into the workforce. So you're going to find a lot of non-traditional students that are going to be in that diploma program. It's just the one that's most flexible, and it's probably going to have the least requirements asked of a candidate, but it's also going to provide the easiest pathway for students to sit for the NCLEX and get right to work. You know, that program might take a year. A BSN program is 3 to 4 years of actual nursing work, and ASN is 2 to 3 years. So the diploma program would be great for students that are non-traditional, maybe working adults, but also maybe some students that have had some academic challenges at some point over the years. Bachelor's is the highest level, basically, of undergraduate work that you can do. We have 1,200 clinical hours in our bachelor's program, so students are going to be well prepped. Obviously, you sit for the NCLEX, become a licensed RN at that point as well, but those students that have earned a bachelor's are going to probably garner the most employment. They're going to command the highest salaries, and so they're going to be who hospitals are looking at specifically most for employment. From a patient care standpoint, you know, you want a nurse that's gone through the rigors of a nursing program, and you certainly do that with a BSN. Our students get a lot of good experiences and exposures to a lot of different areas. Research shows that students with BSN do have better patient outcomes. If you want to go into nursing at the graduate level, you're going to have to go to grad school, and you're going to have that BSN. So having that BSN is going to allow you to take that next step in continuing education. So if you come out into a diploma or an associate's program, you're going to have to continue education at some point if you want to move into like a family nurse practitioner role or midwifery or education such as PhD or something like that. Students get these things called first-time freshman scholarships here at West Virginia University specifically. They're called the Climb Higher Scholarship, and a lot of it's based on GPA, but they do factor some test scores as well, but most of it's based on GPA. So those are usable, you know, while you're completing your undergrad. Obviously, students are going to get, when you complete the FAFSA, you're going to get some state and federal aid potentially there as well. But nursing offers a variety of other additional scholarships that a lot of other majors and programs don't offer. Like there is a nurse corps scholarship through an organization called HRSA. I believe if students work in a rural healthcare setting, they can get, you know, monthly stipend and books paid for and tuition paid for. And so that is available for some of those students as well. But a lot of large healthcare corporations like WVU Medicine, they offer some advantages such as sign-on bonus and student loan reimbursement as well. So there's a lot of benefits financially to nursing, and that's on top of, you know, a great starting salary to help eat away at some of that potential debt that students may or may not accrue in college. And those are all higher ed institutions that have a really good associate's program established already. So for example, with Bridge Valley Community and Technical College in Charleston, West Virginia, they can do their first 2 years of their program at Bridge Valley, and then also their third program at Bridge Valley, and then do their final year online. And so there's a lot of benefits to that, because if you're from that region, from Charleston, West Virginia, for example, and you want to just stay there for 3 years, then do your final year, it allows you to just transition directly through that 4-year program with us. First, there is institutional accreditation. Usually what they look for is regional accreditation. There are 6 regionally accrediting bodies. West Virginia University is accredited by the Higher Learning Commission, or HLC. From a nursing standpoint, you're going to want to look at an actual nursing accrediting body. So for us, we are accredited by CC, which is the Commission on Collegiate Nursing Education. But there's also other accrediting bodies such as ACEN or NLN. And there is another accrediting body for like our nurse anesthetist program. So there's other national nursing accrediting bodies that we have. But you're going to want to make sure that worst case scenario, the program is nationally accredited through CCNE or ACEN or some other national accrediting body. But what I would encourage students to do is to make sure the institution is not only nationally accredited from a program standpoint, but also regionally accredited from an institution standpoint. Just because if you do want to continue your education at any point, like we had talked about before, you're going to have to check both of those boxes. program length, program cost, how flexible it is, what are the requirements, what are my job outcomes and goals, what's my continuing education goals, do I want to be a nurse anesthetist or something like that? Those are all things you should be considering to determine which degree pathway is right for you. If you're wanting to just get right to work relatively quickly, the program might be a better option for you. But if you are a hardworking student and you think that you know what standard you have set for yourself, and you want to go through a BSN program and continue education, you just got to think about what your individual goals are. We have an LPN to BSN program. It's a bridge program for students that have earned an LPN that want to go and earn their BSN. That is through our Potomac State College Kaiser campus. We have an online RN to BSN program. We have our traditional BSN program, mostly geared to high school students or maybe some transfers. But then we have our accelerated BSN program, which is a second degree program. That is going to be for students that have earned a bachelor's degree in another field, but now want to transition into nursing. And then at the graduate level, we have an MSN, Master of Science in Nursing, that features a family nurse practitioner certification. We do have some post-MSN certifications, such as family nurse practitioner, psychiatric mental health, and nurse executive leadership. We have our DNP, nurse anesthetist program, otherwise known as our CRNA program. This is a very competitive program that takes place in person. We have our Doctor to Nursing Practice, our DNP program, and then we also have our Nursing PhD program as well for students that might be into research or education. And we are expanding statewide. Our traditional BSN program is offered in obviously Morgantown, but also Beckley, WVU Tech, and then also Kaiser at Potomac State College. We have our Bridgeport and Morgantown campuses for our accelerated BSN program, Kaiser for the LPN to BSN program. Our Charleston campus houses most of our online and grad programs. And there's been talks about expansions elsewhere. And so we are expanding statewide with our various programs. If someone has questions, they can reach out to me directly, and I'm happy to help them the best I can. And then if I need to send them elsewhere to a program director, I'll be happy to do that.